So this video is to explain the difference between dental erosion, decay and gingivitis and how you can control them or stop them. So the enamel in your mouth is the hardest thing we know. So if you watch any crime movies, you know the teeth hang on. And these little clips explain what it's about. What we didn't have so much in the 60s and 70s was this, which is dental erosion. So you might be familiar with tooth decay. There were lots of fillings done because teeth decayed, and so you take out the decay in the tooth, and traditionally we put in these silver fillings. What we have now is the acidity of generally carbonated drinks in your mouth, and it just takes away the enamel covering your teeth. So this is what they look like. And so we have a specific score called a BEWE, and check how your score compares to your parents'. And this is what can happen. This is when you swish Coca-Cola around the front of your teeth. So this is another site to get information about looking after them. So tooth decay is slightly different. What it is where you have bacteria in your mouth, which we used to call the dental plaque. We probably should still do that. And this, along with sugar, produces an acid. And it's this acid that dissolves the teeth, and it gets colonized by the bacteria in the biofilm, and that's what you need to control. So if you get rid of the or disrupt the biofilm, then your teeth will last longer. It's the same biofilm that actually causes the gums to bleed. And so what happens is that if you don't keep your gums healthy, the biofilm changes. So it changes from being what we say is more aerobic bacteria and viruses to anaerobic. And these bacteria make the gums swell, and that's when you get bleeding. So obviously if you have a brace, it's a lot more difficult. Anyway, the blood goes everywhere, and so it can produce these diseases in old age. So you'll never get rid of the biofilm, but you can keep it healthy simply by using the toothbrush in the correct manner for long enough. So if they do swell up, then just by brushing your teeth properly, they'll get healthier. So the general consensus is now that if you have a healthy mouth, it's more likely that the whole body will be healthy. And so how do you check if you've got a healthy mouth? We've done for years with these extremely inexpensive disclosing tablets. And they work for children and they work for adults. The technique's the same. You chew the tablet for a minute, put your tongue around the outside and inside of all the teeth, have a quick rinse, and then look in your mouth. And there are instructions on the packet. Sometimes you can get a solution which is a bit easier, and you do the same thing. You just look, and you can use a mirror to look and take a selfie. We can all do that now. And as long as you get rid of the discoloration, then you'll be fine. So there are lots of videos showing you how to clean your teeth, and so follow them. And here are a couple of other videos to help you on your way.